Hello, welcome to Monetizing Innovation. I'm John Holcomb. Innovation isn't just the big idea on the whiteboard, it's the hard decisions, the missed signals, and the leaders who keep moving forward anyway. This show dives into real stories behind breakthroughs in life science, healthcare, and tech, how ideas become results, how teams align under pressure, and how strategy turns into execution. If you're building something bold or looking for clarity to lead with confidence, you're in the right place. Press play and let's turn innovation into impact. And today we are joined by a very special guest. Very lucky to have Kelly Cantor here with us. And she is very influential in terms of a health information leader with over 20 years of experience at the crossroads of revenue cycle management, health technology, and product strategy. Kelly is passionate about reducing administrative burden in healthcare and driving thoughtful AI adoption that enhances human experience while advancing patient outcomes. A published author and national speaker, she also serves on the board of the American Health Information Management Association, where she champions innovation and professional excellence. Tune in as we explore her journey, leadership insights, and visions for the future of healthcare. Well, hello, Kelly. Thanks again for joining.
Hi, John. Thank you for having me. I'm looking forward to this conversation for sure.
Oh, likewise. And Kelly, I think with everything you've done, it's really impressive if you look at the length of your career. One of the things that we see a lot happening today in healthcare is this emergence of AI. And, it can create a lot of noise sometimes, but then there's a lot of clear value. So when you look at that from your perspective, where does AI truly add value and where are organizations getting ahead of themselves?
Yeah. So right now, I think, we do know AI is pretty much everywhere. If you turn on the TV, they're talking about it, even, my shoes have AI for some reason. So it really is a lot of it is just noise. It's AI for the sake of saying we have AI. But the real value we need to be looking for and is what are those real operational use cases? Where can it actually make a difference and push forward in that? And so, what I think a lot of folks need to do is really take a step back and think about, where is it mature enough to make a difference? And so we don't want to reinvent healthcare. Well, I mean, eventually we do, but baby steps, and we got to wait for the technology to catch up to our vision of what it is. We've been oversold a lot of that right now. So really, there is a lot of, like I said, places where we can automate, but you still have to be very skeptical of that automation. You have the hallucinations coming through. I'm sure everybody's heard of, oh, it did this wrong or it did that wrong. But we need to step back and say, where can it augment what we do today? Because the more it augments what we do, the more it can learn how to automate. So that's where I think the big thing is. And also think a lot of that noise is again that overhype that we're seeing like, "Oh, we're gonna replace all of our physicians," or I actually had a conversation with the CEO a while back, and he was like, "Coding automation, medical coding automation. We're gonna automate everything 100% in 18 months." Granted, that was probably 18 months ago. I don't see that they've automated anything more than what they were already automating 18 months ago, but I think a lot of that boils down to folks tend to skip the fundamentals. They're not thinking about the data quality and what are you training it on? Governance, interoperability, how are things talking to each other? Especially in healthcare, these things aren't siloed off. Everything you do in healthcare impacts something either upstream or downstream. And so you have to have your vision on that. So right now, the real value, like I said, is going to be in the operational use cases that are very specific and narrowed down where that process is good, you can augment that process. So that's where I really feel like, where we can make a big difference today without having to reinvent the wheel, I guess you could say.
No, absolutely. And I imagine too that, it's not like you can just plop the existing AI models right in because a lot of them are language models that are based on a whole different data set, right? So you need to really train it on the data set that you want to be able to work with, right? Is that a correct assumption?
Well, yeah, that's definitely, and especially in healthcare. If you think about like a chat GPT or a Bard, those are trained on the Internet of Things. They're not trained on healthcare data. Granted, they have some exposure, but There's a lot in healthcare that the internet gets wrong, especially because it's evolving so fast. I mean,
Right.
that's one thing I've always loved about healthcare and tech is the way that you think you know it, and then something new, some new reg comes out or something else happens, and you're like, something new to learn. And you go down that path of, okay, so how does this all fit together? And then on top of that, this new tech is here. And if you're trying to, just like you said, plop it in anywhere, you could be plopping it into a system that's already broke, something that's not working really well already. So you're just going to magnify that problem by like 20-fold by introducing a large language model or machine learning or deep learning even into, something that's already non-functional. You're just exponentially worse.
No, no, and I really like what you point out there too, because I think AI has so much potential when we use it as a tool, right? But it doesn't replace human thought. You still need to have folks that have the insight and the guidance to help steer it in the right direction. Use it productively. And
Definitely. Gotta have those guardrails up,
absolutely.
keep it fine because it will go off the trail if you let it.
Well, in that sense too, I know you've been vocal in the past too about reducing friction for clinicians and health information professionals. What are some of the changes that you might make to be the biggest immediate impact for both the workforce burnout as well as just efficiency?
Well, I think a twofold there. Right now, I'm going to say, clinicians don't necessarily have a burnout problem. It looks like burnout. What they actually have is an administrative problem.
Hmm.
They're doing things that are way below what they've been trained to do or just have not really related at all in what they're trained to do. So you have that issue alone that, they're spending all this time on stuff that doesn't require their expertise. Then on top of that, you have people that don't even bring the clinicians to the table, or, in my space, they don't bring the HIM professionals to the
Hmm.
table when they're starting to build these models and these products out. Well, you know, a product or a tool is only as good as the people that are willing to use it. You know what I mean? So basically, if you could build the best widget in the world, but if somebody's like, this doesn't make my job any better, or, you definitely just added 50 more clicks to my day, they're not going to use it. So you really, I think that's one of the biggest things that's overlooked in AI today is you have these brilliant, don't get me wrong, these people are brilliant data scientists and machine learning engineers that are building out great tools, but they forget to bring the end user to the table to see, is this something you would actually use? You're solving a problem, but are you solving the right problem? You can read a lot of articles, but those articles might not actually give you the ground truth of what's happening. And that's why I kind of laugh about my whole time in product. I feel like a 2-year-old sometimes because I just keep asking why, and then eventually you get to the, oh, it's just this one little thing they're trying to solve for. When you figure out this is the tool I need to build, and then you also have to take a step back because everybody wants to use a large language model. Sometimes it's not an LLM you need. Sometimes that's taking a machete when you need a butter knife. So you got to step back and go, what's the right AI tool to put in place as well? So I think that's where the administrative burden, lessening that comes in, is that twofold, making sure that, we are using the expertise they have and letting folks work at the top of their licensure, but then using them to make sure we are eliminating the work that they don't need to be part of. So that's my soapbox for the moment.
No, no, I love it because I think to your point, that's one of the big challenges. And I think in healthcare too, being a regulated environment, sometimes that can actually compound the problem as well, right? Because folks think that they're putting the right information because of a compliance where it may actually create other challenges, right? For both the information scientist as well as the clinician.
Well, yeah, that's actually the biggest risk
Mm.
is if you don't have, and I see this a lot actually in product development as well. Compliance for legal is like an afterthought at the end. They need to be right first people at the seats with that clinician as you start designing this so they can throw those red flags. The other interesting thing just recently, we haven't really had a lot of federal guidance coming out around these tools. And recently DHHS, the Department of Health and Human Services, did come out with an AI strategy, which was very closely followed by an executive order about kind of, how we want to implement this, AI across the country, which is very interesting because a lot of the states have already been putting out their own AI regs. And at the federal level now they're going, we're going to audit what the states have done to make sure you're still in compliance and you're not doing innovation in a vacuum on top of also kind of making it harder to innovate, because there's a fine line between governance and innovation where sometimes governance can prevent it and innovation, gets stagnated because of it. So I think, at the federal level, they're trying to wrap their arms around it. But again, we don't have any like actual regs. We have an executive order and a strategy, waiting for those regs to come out to see what happens. Where, that's where I think compliance is going to be a big thing as far as AI. But then you do have the traditional compliance of, we're only going to pay you so much for this, or that's not covered by Medicare. So go over here, but that all is why you need the really smart people at the table, which are those lawyers in the compliance office.
And I can imagine from what you just stated there too, the importance of having this regulated at a federal level. Because if you had all 50 states with different regulations, that would be a nightmare for both the information scientists, as well as clinicians, as well as just, you know, everybody in between. I would have to imagine this evolving landscape is a real challenge.
Yeah, especially, I work with a vendor right now,
Mhm.
and we already kind of face that with Medicaid, for instance. Every single state has their own flavor of Medicaid. So, how do you build a really compliant model or a universal model for all of that? And it gets tricky because everybody has their own flavor. Some are very similar, but you have to step back. And then, the big wrench that's always there is Maryland, because they do everything totally different in the revenue cycle space. So you're always like, okay, 49 states plus Maryland.
That's kind of like the automotive in California, right? No, it is funny because you don't think about that, but for healthcare, it's true, right?
Yeah, it's and then introduce that, and then all the thousands of payers out there that kind of do their own things too. So, you know, there is the healthcare ecosystem is so complex that it is going to take a long time to be able to just say, okay, AI is ready to run at this, autonomously. And I don't foresee it happening in the next decade. It's going to take a long time just because of
Sure.
those variants and how fast regs change, how fast, just how clinicians work, the technology that they're actually using is coming around, So it's definitely a little bit wild out there. A little bit of the wild, wild west.
Yeah, exactly. Well, as a leader in this space, how do you help be the sheriff here in the wild, wild west, and help teams navigate some of these challenges?
I think some of the biggest things are there, is really you gotta give folks the environment to explore new ideas, but also understand there's guardrails and there's real implications if you break those guardrails. Hence compliance and legal at the table as you're even talking through whiteboards and discussions about what could be coming next. But I really think like what I personally do, I like to kind of treat regulation as a design constraint. Like, here's your rules. Don't break these rules, but design it, run for it. Be as creative as you want. And I kind of give them a sandbox that's like, all right, this is the end outcome I want you to solve for. How you get there, I don't care. Just solve for this. And you will find that people will come up with some really unique ideas. Or again, they'll come up and be like, well, we really don't need an LLM to do this. Check it out. If we just use some natural language processing and this RPA, we've got this really cool thing that makes this physician not have to fill out this form anymore. You know, and they fill out this form 25 times a day. Look at how much time we're, saving them. So I think the people that really succeed in the space, again, like I said, kind of treat regulation as a design component and not a barrier. And then you really are driving forward to make sure that you're avoiding some risk, but also what is your appetite for risk? Because everything's going to come with a little bit of risk.
Right.
So you have to kind of do that really nice balancing act between compliance and innovation. And I think it's going to keep coming back to that. So again, innovation and compliance, they aren't enemies. They're just dependencies we got to work on.
Well, I think that's a great example that you highlight because it's really the power of these cross-functional teams, right? Especially If you bring the knowledge experts in, from the beginning, to your point, you can really bring that power of a small team, right, to solve the right problem. But if we don't understand the problem, chaos ensues.
You couldn't have said it better. Yes. Chaos definitely ensues if you don't have the subject matter expert sitting at the table. And sometimes that's not just the end user because the end user only has a very small view of, well, this is what I do. Sometimes you have to have those upstream and downstream stakeholders too that are like feeding into it. So, you really have to think about it as who all needs a seat at that table, or we actually talk about it where I work as like who needs a seat on the bus and are they in the right seat? We're trying to drive this thing forward, but if we don't have people sitting in the right seats, then we get stuck at a roadblock, or we put out something that is okay, but doesn't actually solve the problem we're going after. And that's what all this AI is for. Yeah, it's to make things move faster and do things a little bit better, but it is also very much to improve what we're doing. And so that's, what we always have to focus on is incremental improvement as we go and keep testing it to make sure we get the results we're looking for.
Absolutely. And that's certainly no small task, right? From some of the work you've had to describe here.
It's a lot of fun. Sometimes I'm wrangling jellyfish on a daily basis. Uh, but yeah, that's what keeps my life interesting.
No, absolutely. And I think it's funny because that really highlights the importance of that. I think a common theme across industries, right? Innovation really requires that persistence, the dedication to keep on pushing forward to the vision that you can see. And like you said, bringing in the right knowledge stakeholders. And I really love the way you describe, especially within the healthcare system, how difficult that can be.
Yes. And the other piece that I always like to do is, it's okay to fail, but
Right.
you want to fail fast. If you're going to fail, fail fast so you didn't spend 6 months building something that isn't gonna work, and anybody that's out there listening that's a product person, you're like, "Yeah, that's a traditional engineering thing." But we mean it now, like, don't spend too much time somewhere, test it, so if it doesn't work, you can pivot and pivot meaningfully early on. So that's another big thing that, especially in healthcare, because you might be working on something for 2 months and then all of a sudden, guess what? The proposed rule came out and this is all changing.
And I think that's such a great point. I'd be really curious on your thoughts of going a little deeper with that because so many folks, you hear the saying, fail early and do some of that, but now in healthcare, it's even more important, right? Because you think about some of the cost of these computer systems that have been rolled out historically. And, now at the speed at which things are changing, it sounds like that could be disastrous, if we were to put that much money in with all the regs changing as well as, just kind of the technology changing around us.
Yeah, that actually comes back down to what's the amount of risk that you're willing to take because with that risk is a very high spend. And that's the other reason why it's like back up just because the shiny object is a large language model. Does this really warrant that? Because that's the most expensive thing that you could possibly purchase out there. Now, granted, it is getting a little bit more cost effective, but you also have the other side of that house, the actual physical part of it with large language models
Mm.
where you're looking at these massive data centers. Do you really need to build your own massive data center because you're just throwing a large language model at everything? Let's back up and think, yeah, we could just use this computing power that we had 10 years ago can solve the same thing. So it is definitely a place where there is a lot of people that just want to run at the shiny objects, but
Right.
it isn't always the most appropriate thing to do.
Yeah, innovation for innovation's sake is usually not a good idea, right?
Right, exactly. And I forgot about the innovation for innovation's sake. That was something that I dealt with early on in my AI career when I started breaking into this is we would just have these innovation summits and just let's throw things at the wall and see what sticks. That is a huge waste of resources nowadays when you're looking at, paying by token.
You can run up a big bill pretty quick.
Yes, you can. And I actually heard the other day I was reading an article that said, I guess Chat GPT is granted they're keeping it very stable for the cost that's out there for those of us that pay for it, but they're losing money on us because we use that thing like it's going out of style.
Exactly. It's amazing how it's entered into our lives, and it's like it's almost hard to think about like what it was just like even a couple of years ago, in terms of doing some of these basic tasks.
Yeah, very much so, especially in the product world. It has become like this tool where I'm like, oh, I used to have to spend days writing a product requirements document. Now I'm like, here are my requirements. Put the fluff in there and I'll go back and read it and finesse it like it needs to be. But it has made my life so much. I'm not going to say better, just has changed it to where I can focus on the more meaningful things and
Absolutely.
focus on getting things done and testing and talking to folks to make sure I'm solving the actual problem that they need me to solve.
No, absolutely. And I think that's a great use of certainly AI. One of the things too, and I was just thinking about your thoughts on the future of health information management, because we kind of touched on it a little bit already. However, one of the things that, as you were talking, it also made me think about, different hospitals, right? And different hospital systems, because oftentimes they each have their own data structure and things like that and their own firewalls. So they don't want data going outside of the firewalls. How do you see that changing over the next decade? And how do you see AI's role or just any technology role in terms of kind of the current state and where you think we'll be in 10 years?
I think this is kind of a harder question there, and the reason I'm gonna say that is because people don't wanna let go of their biggest asset, and their biggest asset right now is their data, and
Right.
that includes health systems. On top of that, you have the challenge of interoperability, where you start looking at I'm not gonna go into FHIR, FHIR, 'cause I'm dangerous with that. I know HL7 pretty well, though, and if you just look at, like, standard HL7, it's number 1, it's a standard, it's not a rule. And so everybody does it however they want. And I've actually encountered health systems that have 4 hospitals that have different flavors of the same HL7 feed. So I'm like, well, how are you all using the same EHR, maybe a different instance, but you're doing it very differently? How are you sharing data? And, to talk to the administrators there, they're like, "Oh, well, I have to export from each and then do all this manual stuff, and or I send it over to my BI team and it takes them a week to turn it over, turn it back to me." And it's like, we have to solve that problem before we can collectively share it industry-wide. And then you do, of course, have that whole, how much are you actually willing to sell? Because or not sell, but share,
Mhm.
because that does give you a competitive advantage, whether you're a vendor, a health system, that data is huge for developing models internally, externally, however you're going to do it. So I think in the next 10 years, number one, we will find a way to streamline that and get it right to where this dream of being able to pass EHRs from anywhere in the country to anywhere else in the country, any system, could potentially happen. And I do think there are some regulations out there that are floating around that I think some of them have died on the vine, some of them are just sitting there stagnant, gathering dust. But it's something that as AI is rolling out more and more, you're going to see a lot more of that legislation bubbling back to the top of, okay, we can't do anything universally at the federal level because everything's disparate. It's all in different phases, styles. So that'll be the number one thing we got to tackle within the next 10 years. And then once we have that, data governance is going to be the big thing. What are you willing to share? Or are we going to be mandated to share it all? Who knows? So my little crystal ball says we're going to have a little less control than we have today on our data, but that's gonna be to the advantage of the patients at the end and how we treat them, how we're gonna get more proactive in care rather than reactive, because it's all about grabbing that data and being able to siphon through it all across the country and not in our little silos like we're in today.
Yeah, absolutely. And it was interesting. I had a really interesting conversation with a gentleman the other day, and he was discussing the novel concept of creating these basically digital twins, right? So that it helps with that electronic health record. And you're not conveying everything about the patient, but trying to use the records to then use, okay, here's a profile of X patient with this disease, right? And be able to program that out. And it was really fascinating because it highlighted a lot of the points that you're highlighting here too is, you know, some of that data is the competitive advantage, right, of some of these companies and how they do it. But for others, the researchers that are trying to get access to the data, it creates these barriers, right, to actually help with some of the medicine and things like that. Do you see concepts like that playing out or other approaches that might help in some of these long term visions that you just shared?
I do actually see the digital twin. That's
Mhm.
a huge concept that's been being talked about a lot lately, but there's a lot of data processing that comes into that. We're already not real good at getting rid of PHI and PII out of information. We have breaches all the time across the industry, but it that is, I think, a good way to start. The other piece is if we should be starting to look at healthcare as a countrywide asset. And that means, me being able to pick up, not even pick up, me being able to go to a hospital in Arizona when I'm in, when I'm from Michigan and them having my information. And that all boils down to this thing called and I think this is some legislation that's been out there just kind of sitting for a long time, a universal patient identifier where, it's kind of like your social security number where a physician can sign on and be like, this is the universal patient identifier. It pops up my whole medical history. It gives you everything that's out there. But that takes a lot of investment and a lot of time. So back to your point though, it's either going to have to go one way or the other, where we just open up the floodgates and people kind of trust that there's nothing nefarious going to happen with that data. Or we're going to have to spend a lot of time and money making sure that everything is scrubbed as much as we can. I'd be very interested to listen to the podcast with the person talking about the digital twin though, because I'd love to hear their concept. That's not like my full wheelhouse, but it is something that is definitely forefront, especially when you're talking about how do we get there in 10 years? How do we take this friction out? Prior auth, how do we get rid of that? Because the payer can get on and just be like, oh yeah, I can see all this stuff was done and here you go. And I think we're all trying to solve for that right now.
Absolutely. And it is interesting, right? Because there's different facets that this data is used for, from like, the patient data for just even managing the medical records and payment to, now I need to manage my health record, like you said, across state lines. It's a big challenge out there and it's real.
Yeah, it is, and especially like you were talking about with the researchers. That's the other piece is, going back to the data that's even being collected. Is it being collected uniformly? No, in a lot of cases, not. Having a background in medical coding, I can tell you between just 2 hospitals in the same health system, they code differently depending on, are they an academic medical center? Are they critical access? Their needs are very different. So if a certain researcher is looking for certain criteria, you might not get that from a small rural health system because they're just slapping codes on to get reimbursed. Where your big academic medical centers, oh, we're pulling all this information because we know we have researchers. So that's another part that's going to be very challenging is how in the future do we make sure that everybody's represented well. I myself am from a very rural area, and therefore I know I'm underrepresented in a lot of these studies because again, we don't have a lot of staff here that's just trying to capture my entire story. They're just trying to get paid at this point.
No, and I think it's funny because I've started to hear a lot more use of the term, medical deserts, because to your point, some of these rural areas, yeah, they may have access to some healthcare, right? But it's not the same data set that might be available, certainly at, like you said, a research hospital that isn't a major city. And so I definitely your message resonates, I think for sure of the challenge there.
It's real, and I don't think unless you're from a rural area, I don't think a lot of people realize, like, how difficult it is actually to get the full story from people in my area. So,
Absolutely. No, and I think that's, especially if you've had the benefit of living in a well-served area and then moved to a rural area, it's really a rude awakening, right?
it very much was. I will tell you that. I was very used to, my doctor was 2 blocks down the road or, 5-minute drive to now, wait, to get to the nearest hospital, it's a 45-minute drive. So, heaven forbid something happens.
Yeah, exactly. Well, it's really interesting too because this whole conversation has been so fascinating. One of the things I would really like to understand too is your personal leadership journey. So especially, as you look back over your career, what were some of those pivotal experiences that really led you here today? And like, what advice would you have for other emerging healthcare leaders?
So a couple of things, my pivotal areas were not turning down things. There was a couple things that I was offered in my career path that was like, ooh, that's a little scary. That's not what I'm used to doing. But I went for it anyway. And I had some great mentors along the way that were basically saying, Kelly, just because you haven't done it doesn't mean you can't do it. Go try. The other thing is lean into ambiguity. If it's not clear, guess what? You get to make it clear. And if that's something that kind of makes you fulfilled, like it does me, to be able to say, okay, we have all these different pieces. How do I put them together to make a picture? This space is perfect for you. Like leading through that ambiguity and just moving on it. I've always kind of said that the other piece, learn to speak all the different languages of the stakeholders that you're dealing with as a product person again. And I know I keep leaning back on that, but that's why I enjoy it so much. I have to talk like the subject matter expert. So, in my space, I have to know that clinical jargon. I have to talk like an engineer. That means knowing some other acronyms that may actually overlap with the acronyms that I use with clinicians. And then also, lately it's been learning those data science terms and being able to speak their language. And then on top of all that, the administrators. You got to be able to speak finance language too. So it's kind of like just become the hub of conversation and make sure you're always learning. That's the number one thing. And I know it's kind of cliche, but I always say any day that I've learned something new is a great day. And so I try to learn something new every day. The other thing I would say is run towards the hard problems. A lot of people shy away from that. If you want to grow in your career, go for that ambiguity and run for the hard stuff because not only are you going to learn, but you're going to make a real difference. And again, though, you're probably going to fail a few times, but just make sure you fail fast.
No, I love that, and just the way you summarize that is so perfect because I think of actually across industries, so many innovators. I think, like you highlighted, you have to be that student of the business, and I really like you said, you have to learn the language, right, of all the different stakeholders, and that sounds easy on the surface, right, but in reality, it's a challenge, but once you do it, it gives you that ability to translate a lot of those problems.
You become like the little hub of communication because you're the translator.
Absolutely, and it ties straight back to your point about clarity, driving that clarity out of the ambiguity, out of the chaos because and I really love running towards the hard problems. That is just I think a great summary on that. No, I
Sorry.
really oh, no, sorry, I was just gonna say, I really appreciate, all your insights today too. I just wanted to ask, is there anything else you'd like to share with the audience today too that you don't think we covered so far or
No, I think we've hit on most of it. Just, know that innovation's a team sport. I mean, I know it sounds funny, but one brain can't think of every different angle. You need as many collective brains as possible. So, when you are building something out, I was actually talking to somebody this morning, even we were talking about partnering with a vendor. And it was funny because we looked it up and it was like, ooh, they only have like this whole company is only 5 people. Our number one question to them is going to be, who else do you have sitting on your advisory board? How many people are you actually asking the question? So make sure, if you're in this space in healthcare or any other space, using AI or any other type of technology, that you're not doing it in a bubble or a vacuum.
I think that is so huge. No, I think that is probably one of the most valuable insights, right? I really like that. Innovation is a team sport. I totally agree. No,
Yeah.
absolutely. And it's so funny because I've had the benefit of working across multiple industries, from military to pharma to some of the chemical industry, and then getting into some of these discussions around AI and others. And I just find it so fascinating, right? That so many of the I'd say core approaches are the same, and I think your summary of it is perfect, right? In that team sport, bringing in the right experts, being that student of the business is just so critical, and that's really how you lead through innovation, and it's messy and sticky, but, it can be a lot of fun when you get to the other side.
There's nothing more satisfying than walking away from something going, "We did that. Look at what we did." That is, it was a hard road to get there, but look at what we did. Makes it all worth it. Makes the days of, wanting to go pull out all your hair totally worth it.
Exactly. Well, Kelly, thank you so much today. I truly appreciate our discussion. I'm excited to have you basically on our podcast here, and I will also share the details of the other podcast for you as well, so that we can continue to help learn from this group. I think that's one of the main reasons for this podcast is have a community of innovators that can help share ideas, help each other out, and really appreciate you taking your time today.
Absolutely, and I love to network. Anybody out there in the podcast world wants to connect or just chit chat, feel free to reach out. John has my information. I think again, I love learning from other people and kind of what they're doing, and it doesn't even have to be in the healthcare space. I love just in general what's happening in the technology industry because you can always repurpose it somehow.
Exactly. Well, super. Well, thank you so much, and we'll go ahead and end here, and we'll look forward to the next episode of Monetizing Innovation. Thank you,
Yeah,
Kelly.
looking forward to it. I will definitely catch it.